Maintaining a safe environment. Independent adults can assess their environment for risks and prevent accidents in the home, identifying hazards to health and preventing them from happening. Ability to perform safety checks. However, not all patients have the cognitive ability to perform these safety checks and are unable to safeguard their own safety, affecting those with a learning disability or elderly patients with dementia generally. Patients unable to maintain their personal safety rely on nurses to assess their physical environment for risks, plan for safety measures, and evaluate the safety measures put in place. The activity of daily living of maintaining a safe environment can be allocated to Sumira in the OSCE, and the nurse can examine Sumira's ability to complete this AOL. The nursing care plan developed can help maintain a safe environment for her. In the admission booklet, it addresses the orientation status, history of confusion, and whether she has had any falls lately. Sumira has had falls and in fact was admitted following a fall and the head injury she sustained. National Institute for Health and Clinical Excellence's Risk Assessment for Venous Thromboembolism (VTE). All patients should be risk assessed on admission to hospital. Patients should be reassessed within 24 hours of admission and whenever the clinical situation changes. Step 1. Assess all patients admitted to hospital for level of mobility. All surgical patients and all medical patients with significantly reduced mobility should be considered for further risk assessment. Step 2. Review the patient-related factors shown on the assessment sheet against thrombosis risk, ticking each box that applies. Any tick for thrombosis risk should prompt thromboprophylaxis according to NICE guidance. The risk factors identified are not exhaustive. Clinicians may consider additional risks in individual patients and offer thromboprophylaxis as appropriate. Step 3. Review the patient-related factors shown against bleeding risk and tick each box that applies. More than one box can be ticked. Any tick should prompt clinical staff to consider if bleeding risk is sufficient to preclude pharmacological intervention. Guidance on thromboprophylaxis is available at National Institute for Health and Clinical Excellence, 2010, Venous Thromboembolism, Reducing the Risk of Venous Thromboembolism, Deep Vein Thrombosis and Pulmonary Embolism in patients admitted to hospital. NICE Clinical Guideline 92, London, National Institute for Health and Clinical Excellence. If Sumira was on any anticoagulants, they would be stopped while being treated for a subdural hematoma, which could increase her risk of developing a thrombosis. As health educators, nurses must use evidence-based practice in our delivery of care and assessments. As health educators, nurses must use evidence-based practice in our delivery of care and assessments. A campaign aimed at healthcare professionals by NICE, National Institute for Clinical Excellence, was published on 2nd August 2018. Strategy, Policy and Commissioning to Delay or Prevent Onset of Dementia, Disability and Frailty. Here are the following themes to delay or prevent onset of dementia, disability and frailty. Raise awareness, promote healthy lifestyles, lead by example in the public sector, alcohol, diet, physical activity, tobacco, interventions. Physical or biological factors affecting maintaining a safe environment. This considers the overall health of current illness or injury of an individual. These physical factors will be affected by the bleed on her brain, how this injury impairs her physically, and any other factors affecting her ability to prevent falls, ultimately to maintain her own physical safety. Sumira's ability to recognize her body's physical needs to sustain itself, such as good nutrition and sleep, may also be affected. While Sumira is disoriented and confused after her head injury, she has a greatly reduced ability to assess her environment for hazards. She usually walks with a walking aid and has a history of falls. Sumira is confused and may not be able to recognize hazards and safe boundaries. She will need supervision to maintain her safety when mobilizing. Sumira may experience problems completing ADLs, such as washing and dressing, due to confusion. She may require supervision to ensure that she is able to complete these activities. She has a habit of drinking excess alcohol, and this could lead to further hazardous situations. Smoking cigarettes could also pose a fire risk. Psychological factors of maintaining a safe environment considers the impact of not only emotion, but cognition, spiritual beliefs, and the ability to understand. In assessing Sumira's ability to maintain a safe environment physically, remember Roper's advice that we should consider the psychological and sociological aspects of maintaining a safe environment. Roper defines the psychological aspect of this AOL as a feeling of being safe. A person who is independent in this AOL can interpret their environment, recognize and quantify hazards, and feel safe if there is no threat. Whereas a patient who is confused may need additional support to feel safe as they are unable to interpret their environment. For example, if a call bell rings on the ward, an independent person understands there is nothing to worry about, but a disoriented patient may feel anxious or alarmed as they fail to make sense of the sound. She may require additional psychological support in this area to relieve her anxieties and help reorientate her. Sociocultural aspects of the AOL maintaining a safe environment. This considers the impact of society and culture experienced by the individual. Firstly, it is concerned with viewing Sumira as a whole person who has the responsibilities of being a wife and a grandmother. Her confused condition may affect her ability to function as normal in these family roles and change family dynamics as a result. Her hospitalization may affect her ability to perform household tasks she would normally do, and therefore her family should be involved in the plan of care. This will also help alleviate stress Sumira may feel due to her limited abilities, and help her family to understand and support her effectively upon discharge. Also, you should consider that her family may be struggling with her reduced abilities, as Sumira had the role of housewife looking after the home and family, and this will be a huge change for everyone, especially for herself and her husband. After discussing these issues, it may become apparent her husband and family cannot perform the tasks she is usually responsible for. Therefore, outside agencies, other family members or friends, and may become involved in these household chores and responsibilities. This can all be discussed with her and her husband during the care planning phase to ensure safety is maintained for Sumira on discharge. Roper 2002 says of social-cultural factors that the impact of society and culture experienced by the individual. Expectations and values based on perceived or actual social class or status, or related to the individual's perceived or actual health or ability to carry out activities of daily living. Culture within this factor relates to the beliefs, expectations and values held by the individual, both for themselves and by others, pertaining to their independence in and ability to carry out activities of daily living. Summary of Sumira's ability to maintain a safe environment. Sumira is unable to maintain a safe physical environment. She is disoriented, confused, and at risk of falls. She will need assistance to achieve the ADLs of mobilizing, washing and dressing, eating, drinking, and elimination. She needs health education in the areas of smoking and excess alcohol consumption. She is unable to maintain the safety of dependents. Sumira needs assistance to maintain a safe psychological environment as she is disorientated, anxious, and will need nursing interventions to reduce anxiety and gently assist her with reorientation. Sumira's family are anxious and concerned and need to be kept informed on her hospital care. In the OSCE, if you have not been able to discuss these aspects of maintaining safety during assessment, you can plan for that discussion to take place with Sumira and her husband. You can verbalize this. A campaign aimed at healthcare professionals by NICE, National Institute for Clinical Excellence, was published on 2nd August 2018. Strategy, policy, and commissioning to delay or prevent onset of dementia, disability, and frailty. Here, the following themes to delay or prevent onset of dementia, disability, and frailty are set out. Raise awareness, promote healthy lifestyles, lead by example in the public sector, alcohol, diet, physical activity, tobacco, interventions. So we as nurses are expected to promote healthy lifestyle choices and give guidance about services that can support them.